it should involve a range of stakeholders, and enough of them to understand the overall problem. And so a really key question that was asked before was, every time I ask this question, someone else raises a new problem. You cannot, constantly chase your tail. But equally, if you speak to one or two people, and that's also probably not enough, because that's not going to give you enough of a holistic overview of what the problem may be. And also they have their own lens with which they view things too. So it's understanding who you need to talk to in this ecosystem, and how many people perhaps you should talk to make sure that you have a well-rounded, kind of balanced understanding of the needs, and therefore then the solution that you can bring to the table to solve some of those problems. And this may involve not just when we speak of sort of end users, usually it's the people who are going to be using the technology, but it's also the carers that may be supporting someone to use that technology, or may be impacted by the use of that technology itself. So for example, if you have a technology that supports someone with a mild cognitive impairment who's living at home, that's fantastic, but naturally the use of that technology by that individual may have a flow-on effect for the carers. It also touches perhaps social prescribers as well, who are not the intended user of the technology, but they are the ones who point the user in the direction of this technology, and that's part of that care pathway and journey. The process itself should have a sound methodology, and there are lots of different ways to approach this as well. And I won't go into the nuances of that, because it really depends on the technology, who your end users are, and who's involved or impacted by the use of the technology, and also where you are on that innovation journey. But what is key is really to document the processes that you have undertaken, the insights that you've gleaned, and then the outcomes of those as well. Documenting them, it doesn't have to be a robust documentation, but it has to be written down somewhere so that you can reflect on it. And also that's really useful for being awarded grants, for investors as well. And also at the end of the line, if you're developing a technology which is perhaps going to be procured by government, you can provide all of this evidence of the entire journey that you've been on from the very beginning, from ideation through to innovation, implementation, and the evaluation of the technologies too, to really prove that you have involved everyone who should be involved in this process along the way. Ultimately, it is co-design in digital health is the development of technologies with the people who ultimately use it, implement it, or be directly or indirectly impacted by it. So it is important because, like I said, the environment is complex and it's dynamic and changing. So having an understanding of that as you evolve is really key. We want the technologies to be end user focused, absolutely. And these end users may have different perspectives too. So having enough conversations to be able to feel like you're viewing things with more of a holistic lens is really key. But key takeaway from me, engaging early and often. It is difficult to do, perhaps, but absolutely essential in this space.
When I'm assessing an application, when I'm considering, can I take this forward for investment? 4 items in particular that we look at in terms of the user are tangibility, engagement, active learning, and entrustment, all of which I think are really important when you're considering your design. So we're going to first of all look at tangibility through Musica. So they do a musical intervention for dementia. They're currently working still on their proof of product with a new product that they've designed. But when they first came to us, what they showed us is that they'd done studies with live music on patients in hospital. They'd found statistically significant improvement, and they'd shown that there was a reduction in anxiety. So they had some really concrete outcomes that we could review. They also showed us their theory of change, which is a charitable term, but reflects, I think, the design user statement, where they looked at the problem, they looked at the outcomes, they looked at how they were going to measure those. I'm going to look at now Apt Health. So they're working with GPs. They are working with GPs to improve the uptake of preventative and ongoing health screening checks, which is a really hard market to tackle and really difficult for GPs to achieve. And what they're particularly interested in was, how do you reach the parts of the population who are really bad at taking these up? And their innovation and the way that they work with people means that they're being able to reach further into the lower IMD deciles, that is, the more deprived districts, which typically have more people of the global majority, more people with disabilities, more people with long-term health conditions, more women, and more LGBTQ populations in them. And so by showing that they're able to reach into places where there's greater deprivation and get more bookings from those people, then they're able to show that they're reaching parts of the population that GPs are struggling to reach with these preventative health checks. And this is a great example of the how and who is being reached. Next investee I'm going to talk through our Personal Alarm Watch. And they have shown a really great example of active learning, because when they first were talking to us, they were looking at one particular solution to a problem, which is falls in older people. And they were going, well, we'll do a radar system, we'll analyze people's gait. Then they went and talked to some older people, and the older people said, no, we don't want that in our home. It will cost lots of money. What we're actually worried about is what happens if we fall. But we don't like pendants because they're quite stigmatizing, and actually they're really restrictive. And so they went away, they refocused, they came up with a watch. That means you can call people when you're outside of your house, and they have continued to work on their product, work on their service, and they think it through and talk through with workshops time and again. It's that iteration. They're on the market, as are all of these organizations, and they've done really well. And here we're going to have a look at entrustment with GoodBoost. So they're an app and a tablet that goes for swimming pools, but they've also got apps that work on mobile phones. And they're also another active learning great example, because what they haven't done is gone, well, what we want to do is we want to do the app that goes on the phone that works for people in their homes, and the app that goes for people working in private pools, and we'll have a product that works in small pools, and we'll do this and we'll do that. They started with one bit of their product. They've got it really working for swimming pools and for the use in swimming pools. Then they've gone out and they've raised more funding and more investment, and they've worked on the next steps in their product. And now they're working on the next steps again. So they're bringing in artificial intelligence. So where does it end? You don't have to end it, but you have to draw lines, and you have to decide when you're going to launch something that's going to start generating new revenues, and when you can build on that. And you can actually use these great ideas. I'm just saying, well, what do we do when we've got lots of ideas? Well, you can start building some of those in to be your type of innovations. That means maybe somebody will start paying from bronze to silver to gold. If you've got an app that you want to set different price points, you don't have to have everything for everyone. But back to entrustment, GoodBoost could have something that just makes people feel good in terms of giving them musculoskeletal rehab, using a pool-based system. And that means that if people don't really get better, they keep coming back. But actually what they're looking to do is improve the users of their technology so that they have greater mobility, greater confidence, and are more likely to be active when they're no longer reliant on their service. And so what they're looking at is they look at specific functional scales, because they work in the health space, and you can see that they're looking at quality of life, pain functionality, and how functional their patients are. if you have users on your board involved in your process every step of the way, on your teams of staff, in your product designers, you will get a better product because they will continue to be feeding back in, and you're not reliant on going back out and asking. Though that's not to say you should rely wholly on that one voice, because as has already been mentioned, users come in all shapes and sizes, backgrounds, ethnicities, genders. We know this. Do you? I want to know that you're talking to lots of people, that you're making changes, that your process is iterative and open, and that you're not closed-minded. So when you've made one change, if it's not working, you're prepared to undo it. And that you really thought about the cost of keeping on changing, that you've not got an end product and gone, well, that's it. Think about your Dyson Hoover. That is not the same Hoover that it was, a vacuum cleaner, when it was first released. The Dysons you have on the market now are hugely different. That's because Dyson keep iterating, they keep changing, they keep adapting as they go.
So the three key ingredients that I talk about when we talk about European Space Agency funding is these three. So the first thing is commercial focus. So the funding is not just pure R&D funding. It's not technology push, it's more market pull. So actually a lot of what the previous speaker was talking about is really relevant here as well. So yeah, this is very much about a commercial focus and understanding what your users want, okay? So it's not just R&D, it's not just about developing widgets, it's really looking at what your end clients are after. There's also the second key ingredient is customer engagement. So here it's all about working with your users and your clients to understand what the application and service is. So when you're applying for this sort of funding, very much it's important to engage with your client base and have them involved if you can. And then finally, because it is space-based funding, there is obviously you need to have some sort of space asset in the value propositions. There needs to be some sort of utilization of existing space capabilities. So that could be satellite telecommunications, satellite navigation, or use of Earth observation data. In terms of funding, the funding from European Space Agency actually comes from the various national delegates. So in the UK, that's the UK Space Agency. And funding's typically 50% of the total project value. They sometimes give more, but it's usually around that amount. And match funding can come from either private investment or client support or some sort of in-kind contribution or use of computers. There's all sorts of ways in which you can deal with the match funding. And then in terms of the actual project range, in terms of value, it can be anything from 60k euro through to 2 million plus euros. So there's a significant amount of funding here. So if you've got a really good idea, then there is definitely opportunity here for funding. You've just got to hit those three key ingredients about, you know, the commercial focus, the customer engagement, and the space in the value chain. And then contracts, that's an important one because it's not a typical grant process. Grants are typically you spend money, then you claim that money, and then you get that money back. That's how grants work. In this situation, you actually enter into a firm fixed price agreement with the European Space Agency with payments based on milestones. So what that means is you can put in a front-loaded payment of, say, 30% up front, and then you know, so much in the middle and so much at the end. So from a cash flow perspective, you know, the funding is a lot easier to handle than always getting paid in arrears after you've done the work. So it's not like typical grant funding. It's done, I think, in a better way than that. So it's very interesting. There's two different types of calls. There's the open call, which is really any idea in any industry. Okay, that really, you know, is open to anybody. And then under that, there's two typical types of work that ESA expect. One is a feasibility study, which is really looking at commercial feasibility of applications. Again, remember, this is all about a commercial focus. And they're typically about 12 months long. And then there's demonstration projects, which is then about actually doing full demonstrations with with clients and users. And you would typically expect the technology readiness levels to be a bit higher here, and really just pre-market. You're just wanting to have that funding to help you demonstrate the service or the application before taking it to market, and they're typically 12 to 18 months long. Then there's also themed calls that pop out every so often as well, and I've got a list of those just in a moment, but really they are looking at specific market sectors such as health or such as agriculture or whatever it is, and really looking at stimulating interest in those particular market sectors. But again, you know, the key ingredients are the same. You know, you've got to use some sort of space-based asset, and there needs to be a good commercial focus. And under there's sometimes Kickstarters that get raised. They're typically only 60k euro funded, but they're funded at 75%, looking at, you know, kickstarting new services and applications in specific sectors. And then also under the theme calls, you can do demo and feasibility studies like in the open call. So this is a list of current current theme calls that are open, along with the open call, which is there. There's the top one there, which is Space Acting for Decarbonisation. That's really looking at the net zero agenda and really looking at applications in any sector which can utilize space-based assets to support net zero. So that one is open now, and it's closing next month. You've then got one in digital transformation in public safety, and also one in space in response to the humanitarian crisis. Then there's a couple of longer term calls. There's one specifically looking at the health sector and looking at future hospital initiatives that can utilize space-based data for, you know, commercial services to support the health sector. Then there's one focusing around the tourism sector, one focusing around safety and security as well. And then finally, this bottom one is commercial applications enabled by space environments. So that's really looking at applications in space using microgravity services, things like this, you know, so space-based applications in space that have commercial potential exploitation. But the big red arrow there is where to go and have a look, because that website gives you a list of all the various calls that are open. And as I said, there's the open call, which is there as well, which is there all the time for any idea, and you can come and have a chat about it.